All right, good morning, everyone. Today my talk will be on whether vision loss from diabetic retinopathy can be prevented. So what is diabetes? We all know that diabetes can be due to elevated blood sugar levels, and is generally due to insulin resistance, and in some patients there is lack of insulin. In a 2020 National Health Survey in Singapore, it was found that about 10% of men were diabetic compared to 8% of women. So diabetes can affect many parts of the body, the foot, the kidneys, the heart, the blood vessels, and more importantly to us, the eyes. So diabetes can affect the retina of the eye. And what is the retina? Retina is the back of the eye. So it contains light sensitive cells which sends nerve impulses to the brain. So it's akin to the film of the camera. And when diabetes affects the eye, one gets something called diabetic retinopathy. So it is a disorder of the blood vessels in the retina of patients with diabetes, and it is the leading cause of new blindness in working adults in developed countries such as Singapore. And how can diabetes affect women? So we know that there's something called gestational diabetes, as well as diabetic eye disease. So we know that during pregnancy, some women can get gestational diabetes. And we know that in this group of patients, about half of them with gestational diabetes go on to develop type 2 diabetes. And about 10% soon after delivery, and 20 to 60% 5 to 10 years after the index pregnancy. And we also know that if a woman has diabetes with diabetic retinopathy, it tends to worsen during pregnancy. And also DR is harder to manage during pregnancy. So diabetes and diabetic retinopathy is a problem that we need to look at in women. And in this study out of Australia, they looked at the prevalence of diabetic retinopathy in women who have diabetes before getting pregnant, during pregnancy, as well as after. And it was found that out of 100 eyes, 24 eyes had diabetic retinopathy, and about 10% of eyes had sight-threatening diabetic retinopathy. So who are at risk? We know that all diabetics are at risk of diabetic retinopathy, especially if you have diabetes for a long time, if your diabetes is poorly controlled, and you have a history of gestational diabetes, which is a problem that is unique to women. Diabetic retinopathy can cause blindness, but it can be prevented with early detection. In our study, we found that about 1/5 of Singaporean patients who underwent screening were found to have diabetic retinopathy. And about 10% had sight-threatening disease, and that's why it's a common problem in Singapore. So how do we prevent diabetic retinopathy? Prevention can be divided into primary, secondary, as well as tertiary. So if you're diabetic, first of all, is to control your blood sugar, to keep it below 7%, and also to control other systemic medical problems such as blood pressure, high cholesterol, heart problems, as well as kidney problems. And if one is smoking, and that should be stopped as well. So I would also recommend a regular exercise as well as a healthy diet. So secondary prevention are measures that lead to early diagnosis as well as prompt treatment. So how do we secondarily prevent diabetic retinopathy? First of all, if you have diabetes, pay attention to any changes in your vision. And if you have diabetes, you should get regular eye checks. What are types of diabetic retinopathy? So DR can affect the peripheral retina as well as the central retina. When it affects the peripheral retina, we generally term it diabetic retinopathy. And if it affects the central retina, we call it diabetic macular edema, which is swelling of the central vision. So furthermore, we can further classify the peripheral retina diabetic retinopathy into non-proliferative versus proliferative. That is when new blood vessels have formed. And in the central retina, if there's swelling, we term it macular edema. And if there's swelling in the central retina, one can develop a visual loss quite early in the course of the disease. So if you have swelling in the central retina, you can have drop in your vision, or you can have distorted vision as well. So how would one know that one has diabetic retinopathy? I think first of all, if you develop symptoms, then you might be in a quite late stage of disease. Most people with diabetic retinopathy have perfectly normal vision. But if you have a gradual blurring of vision, or you have floaters, lots of floaters, that can be due to bleeding from the blood vessels, or you can have decreased central vision, and that can be due to swelling in the center of the eye. So I would like to emphasize that if you have diabetes, annual routine eye screening is very important. Screening is available in all polyclinics, diabetic centers, Singapore National Eye Centre, all other tertiary hospitals. So we detect diabetic retinopathy with a comprehensive eye examination. Usually, if you come to Singapore National Eye Centre, we would apply eye drops to dilate your pupils, and that we'll be able to check and see if there's any diabetic retinopathy. There are also in the polyclinic fundus retina cameras that do not require dilation, and that is a good screening tool for DR. Other things that we do in the specialized care in Singapore National Eye Centre, if there's swelling in the in your central vision, we may do something called the optical coherence tomography that obtains a cross section of the retina, and it will be able to tell us the amount of swelling that one has in the central retina. Sometimes we may inject a dye into the vein and take some pictures, and we call it the fluorescein dye test. It's generally quite safe, but some of the risks include nausea or allergic reactions. So if one has non-proliferative DR, no treatment is required, but frequent monitoring is required according to the severity of the disease. Treatment is indicated if one has proliferative DR or macular edema. So we treat diabetic retinopathy as well as diabetic macular edema in order to prevent further complications, to save the vision. But I would like to emphasize that if the DR is severe, vision may never recover completely. So some of the treatments that we may perform include laser treatment. This is an eye that had laser performed to the peripheral retina to stabilize a disease such as proliferative diabetic retinopathy. We also commonly do monthly intravitreal injections into the eye, and this is mainly for swelling in the central retina. So one would require generally about 6 to 8 injections in the first year, and the second year maybe about 3 to 4 injections and about 1 to 2 injections. So I would like to emphasize that this is a long-term treatment to treat diabetic macular edema, and this injection sometimes has also been shown to reduce proliferative diabetic retinopathy as well as bleeding from the abnormal blood vessels. Lastly, this in a very advanced stage of diabetic retinopathy, in a developed country like Singapore, we really shouldn't be seeing much of this. The retina can have retinal detachment, a lot of scarring, scar tissue, and if the disease progresses to this stage, then we will have to do a surgery such as vitrectomy. But the visual prognosis generally is not very good after this type of surgery. So lastly, prevention is better than cure. We do not want to wait until the disease gets to advanced stage before we institute any treatment. So I hope that from this talk, you've been able to learn something. Thank you very much.